Good morning, everyone. Welcome to yet another OIT writing live session airing from Tejas Academy. Yes, so as usual, we people are back with yet another OIT writing live session. And as you people can see on the screen, I have chosen the topic that maternal and child health nurse as reader in OIT writing. So this is going to be our topic of discussion for today's live session. So once again, warm good morning to each and everyone out there to yet another writing live session airing from Tejas Academy, Mavalikara, and this is Aishwarya here with you people. All right, so without wasting much time, yes, hi Nainika, good morning, welcome to the session. All right, okay. So in this particular live session, what we are going to do is how we are supposed to write the letter when the reader of our letter is going to be a maternal and child health nurse. So see, when it comes to this particular aspect, what we have to do is we have to take care of this the entire aspects of this letter. Yes, Disha, Mariam, Vidya, good morning, everyone. Yes, Devadashani, good morning, dear. Good morning, and welcome to yet another live session. Okay, all right. Okay, so before I begin this particular live session, what I wanted to tell you is on this coming Saturday, we are going to have the another set of OET examination. So all the very best to those people, those who are going to have their exam on this coming Saturday. Your coming Saturday OET exam എഴുതാൻ പോകുന്ന എല്ലാവർക്കും on behalf of our entire teachers family, we wish you all the very best. So that is what I wanted to tell you people. And see, be very confident with your presentation and presentation and your preparation, and just ഇത്ര നാളും നിങ്ങൾ ചെയ്ത ഹാർഡ് വർക്കുകളെല്ലാം തന്നെ വിശ്വസിച്ചുകൊണ്ട് വളരെ കോൺഫിഡൻ്റ് ആയിട്ട് just go for your exam and clear your exam with high scores. That is what we wanted to tell you. So on that positive note, let's just begin today's live session. Okay, so in order to identify this particular letter, the reader, so I have prepared a case note, and based on this case note, we are going to have the discussion. So let's begin with the case note. So as you people can see, so the name of the patient was mentioned here. Brett Davis was brought to the Children's Hospital by his mother, who was concerned that he had a cold. So the name of the patient is Brett Davis. This is going to be the name of the patient. All right, and he was brought to the hospital by his mother because he had a cold. So he എന്നുള്ളതിൽ നിന്ന് we can understand that the gender of the patient എന്ന് പറയുന്നത് male ആണ് എന്ന് നമുക്ക് മനസ്സിലായി. And by his mother, with the concern that the patient is having the concern, the mother is having the concern that the kid is having cold, കുട്ടിക്ക് കോൾഡ് ആണ് എന്നുള്ള കൺസേണിലാണ് നമ്മൾ പോകുന്നത്. And he has had a stuffy nose for the last 2 months, but this was worse. He is to be discharged in the care of his family with a referral to the maternal child health nurse at the local clinic. So for the last 2 months, the patient was having a stuffy nose ആയിരുന്നു പേഷ്യന്റിന് ഉണ്ടായിരുന്നത്. ആ ഒരു stuffy നോസിൻ്റെ issues ഒക്കെ ഇപ്പോൾ എന്തായാലും വേഴ്സൺ ആയി. So after getting the treatment from the hospital, the patient is going to get discharged with his family, and there's also a referral is being arranged for maternal child health nurse. So the name of the patient is mentioned there, and the date of birth, that is also mentioned, and address, and admission and discharge date has also been mentioned. So admission date എന്ന് പറയുന്നത് എന്താണ്? 4/7/1993. So this is going to be an old case like 4/7/1993. So which means this is going to be July. The July ആണ് മനസ്സിലായി. And the date of birth is February 1993 February. So Feb is the date of birth. So it has happened, this baby is having a few month old. ഒരു വയസ്സ് പോലും തികയാത്ത ഒരു few month old ആയിട്ടുള്ള ഒരു കുട്ടിയാണ് നമ്മളുടെ patient എന്ന് മനസ്സിലാക്കാം. And the gender male ആണെന്ന് മനസ്സിലായി. As it is a baby, we can take it as a minor case. ഇതൊരു minor case ആയിട്ടാണ് നമ്മൾ എടുക്കേണ്ടത് തന്നെ. So because of that, we don't need to use the title as well. നമ്മൾ എന്ത് യൂസ് ചെയ്യേണ്ട കാര്യമില്ല, title യൂസ് ചെയ്യേണ്ട കാര്യമില്ല. So I hope it is clear so far. So the name of the patient have been received, the date of birth we have got, and admission and discharge date of the patient was also been mentioned here. So as per, by comparing the admission and the date of birth, we could see that the patient happened to be born on February. So handy, that is going to be, and the admission happened in the month of July. So basically, it can be considered as a 5 month old, 5 month old ആയിട്ടുള്ള ഒരു ബേബിയാണ് നമ്മുടെ പേഷ്യൻ്റ് എന്ന് നമുക്ക് മനസ്സിലായി. Now let's move on to the rest of the letter. So let's see the rest of the letter. So as per the social background, second child in the family, one sister, aged 5. So as per the social background, he is the second child in our family, and there is one sister for the patient. Patient and ഒരു elder sister ഉണ്ട്. And June Davis, age 23, waitress, evening shift, work till late night. So that is the information that we received regarding his mother. His mother is just 23-year-old and he is working till late night work ചെയ്യുന്ന ഒരു മദറാണ് നമ്മുടെ പേഷ്യൻറ്റിന് എന്ന് നമുക്ക് മനസ്സിലാക്കാം. And the father, Malcolm Davis, construction worker, work during day, lives with parents and siblings in a rented 2-bedroom flats. So his father is a construction worker who is working throughout the day. Basically, both his mother and his father both are working throughout the day. They are basically very busy with the work schedule എന്ന് നമുക്ക് മനസ്സിലാക്കാം. And the child lives with parent and sibling in a rented 2-bedroom flat എന്ന് നമുക്ക് മനസ്സിലായി. And the diagnosis says otitis media, chronic nasal congestion and acute respiratory tract infection. So these three are his current diagnosis. ഈ മൂന്ന് കണ്ടീഷൻ ആണ് നമ്മുടെ പേഷ്യൻറ്റിൻ്റെ current diagnosis ആയിട്ട് നമുക്ക് കേസ് നോട്ടിൽ തന്നിരിക്കുന്നത്. And let's see the nursing management and progress. So the patient was conducted with a Denver development screening test done which indicated normal development. So ഈ ഒരു screening test done which means it's already happened and it is normal ആണെന്ന് നമുക്ക് മനസ്സിലായി. And the patient was managed with the amoxicillin antibiotics, nasal and ear toilets before feeds as required. Nasal and ear toilets were also provided before feeds. Febrile after 36 hours. After 36 hours, the patient became febrile, means he doesn't have any fever. Free fluid, which were well tolerated, but congestion restricted sucking ability. So he was tolerating the fluid that was mentioned there, but the congestion restricted sucking ability of the patient. So basically, it's just a 5-month-old baby, so he couldn't suck the food properly because of the nasal congestion. That is mentioned here. Okay, so I hope it is clear so far. And moving on to the discharge plan, support to Mrs. Davis in improving parental skill. Parental skills improve ചെയ്യാനായിട്ട് മദറിന് സപ്പോർട്ട് കൊടുക്കണം എന്ന് പറയുന്നുണ്ട്. Continue antibiotics, observe for signs of elevated temperature. So we have to continue the antibiotics and observe for the signs of elevated temperature. So these are the discharge plan prepared for the patient. So Brett's parents will be instructed to take the child to Albans Community Health Clinic on the day following the discharge. Write a referral letter to Mary Bonnier, Maternal and Child Health Nurse for the follow-up discharge plan. So this is what the letter is all being about. So it's going to be a very small letter, but see, what you have to understand is the patient is going to be a minor. So we have to take care of the information that we are writing in the letter with respect to the reference line. Reference line എഴുതുമ്പോൾ നമ്മൾ ശ്രദ്ധിക്കേണ്ടതായിട്ടുണ്ട്. When we are writing the letter, while we are writing the name of the patient in the body paragraph and in the introduction, there are certain things that you people need to be take care of. So ഈ പറയുന്ന കാര്യങ്ങളെല്ലാം ഈ പറയുന്ന ലെറ്ററിൽ നമ്മൾ ശ്രദ്ധിക്കേണ്ടതായിട്ടുണ്ട്. So first of all, by analyzing the writing task, we could understand that this is a referral letter. So this is going to be a complete referral letter, and we understood the name of the റീഡറിൻ്റെ പേര് കൊടുത്തിട്ടുണ്ട്, ഡെസിഗ്നേഷൻ കൊടുത്തിട്ടുണ്ട്, ആൽബൻസ് കമ്മ്യൂണിറ്റി ഹെൽത്ത് ക്ലിനിക്. So here the address part is totally scattered here. Address part ഒരു ഓർഗനൈസ്ഡ് ആയിട്ടല്ല, പല പല ഏരിയകളിലായിട്ടാണ് തന്നിരിക്കുന്നത്. So you have to organize it. So first of all, you have to go with the name of the reader. Then second, it is very important, you have to start with the designation. And finally, you have to talk about Albans Community Health Clinic. ഇത്രയും കാര്യങ്ങൾ നമ്മൾ 1 2 3 4 പോലെ നമ്മൾ അറേഞ്ച് ചെയ്ത് വേണം അഡ്രസ്സിൽ എഴുതാനായിട്ട്. And another thing that we can identify from here is follow-up care plan. So here, continue the antibiotics. So the reader has to take care of the patient with their antibiotics. So basically, that can be considered as ongoing care. So the first purpose word that we can choose for this particular letter is ongoing care, and the synonyms of the ongoing care are follow-up care or continuing care. So you can write any one of this particular word as the first purpose word. And the second purpose word, that is observe, that is can be taken as monitoring or observation. So any one of these two can also be considered as a second purposeful. And as it is a referral letter, you can write, I am writing to refer. And the full name of the patient should be there in the introduction. That should be there in the introduction. That is Brett John Davis. So I'm writing to refer Brett John Davis, who requires follow-up care and monitoring. That should be the first line of the sentence. And what all are his conditions? എന്തൊക്കെയാണ് അയാളുടെ conditions or the current medical status എന്നുള്ള കാര്യം നമുക്ക് നോക്കാം. So as per the diagnosis, it is mentioned that he has otitis media, chronic nasal congestion and acute upper respiratory tract infection. So ഈ പറയുന്ന മൂന്ന് കാര്യങ്ങളായിട്ട് the patient is being discharged. Discharge means his condition has been stabilized. പേഷ്യൻറ്റിൻ്റെ കണ്ടീഷൻ എന്തായി, സ്റ്റെബിലൈസ്ഡ് ആയി എന്ന് പറയുന്നുണ്ട്. സോ ആസ് ഇറ്റ്സ് കണ്ടീഷൻ ഇസ് ബീങ് സ്റ്റെബിലൈസ്ഡ്, യു ക്യാൻ റൈറ്റ് വാസ് ഡയഗ്നോസ്ഡ് എന്ന് പറയുന്നതായിട്ട് നമുക്ക് കണ്ടീഷൻ സ്റ്റെബിലൈസ് ആയ രീതിയിൽ എഴുതാം. ഓർ യു ക്യാൻ ഐദർ റൈറ്റ് ഹീസ് റിക്കവറിങ് ഫ്രം ഓൾ ദിസ്, എന്നുള്ള കാര്യവും നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും, പറയാനായിട്ട് പറ്റും. So otitis media, chronic nasal congestion and acute upper respiratory tract infection. So എങ്ങനെ രണ്ട് രീതിയിലാണ് ഇവിടെ സെൻറ്റൻസ് കൺസ്ട്രക്ഷൻ പോകാവുന്നത്. either you can write he is recovering from, so is recovering from എന്ന് നമുക്ക് പറയാം, and or you can go with was diagnosed with. So I hope you people understood the difference between, I hope you people can understand or already know the difference between has been diagnosed, has and was diagnosed. So where we are writing has been diagnosed as, that's going to be a recent diagnosis without management. Management il kodukade allengil management stage vare ettatha oru recent diagnosis aanu ennu parayunnathu ee oru condition ennu parayunnathu. Pinne namukku parayavunna karyam has aanu. Pinne namukku parayam or has ennu parnal we have provided the management but still the patient is suffering with the condition. So on that note you can go with has. And the final thing എന്ന് പറയുന്നത്, even after providing the condition, the patient's condition has been, after providing the medication, the patient's condition has been stabilize ചെയ്ത് കഴിഞ്ഞാൽ നമുക്ക് എന്ത് എഴുതാവുന്നതാണ്, was diagnosed with എഴുതാവുന്നതാണ്. So ഈ ഒരു കോണ്ടെക്സ്റ്റിൽ was diagnosed with or recovering from both these situations are actually favorable ഈ ഒരു introduction construct ചെയ്യാനായിട്ട്. Then we have to move on with the present condition. So present condition എന്ന് പറയുമ്പോൾ, because when it comes to the social and medical history of the patient, there is nothing that relevant with his current condition. Current conditionുമായിട്ട് അത്ര relevant ആയിട്ടുള്ള സംഭവങ്ങളൊന്നും ഇല്ലാത്തത് കൊണ്ട് we can proceed with the type 2 organization where we are starting the present condition of the patient. പേഷ്യൻറ്റിൻ്റെ പ്രസൻറ്റ് കണ്ടീഷനുമായിട്ട് നമുക്ക് എന്ത് ചെയ്യാവുന്നതാണ്, ഈ ഒരു ലെറ്റർ സ്റ്റാർട്ട് ചെയ്യാവുന്നതാണ്. സോ അപ്പോൾ നമുക്ക് എന്ത് പറയാം, he was brought to the children's hospital with the concern of cold-ന്റെ കൺസേണുമായിട്ടാണ്, was brought to the children's hospital by his mother with the concern of cold എന്ന് പറയാം. He had a stuffy nose for the last 2 months which has worsened. ആ ഒരു സ്റ്റഫി നോസ് ഉണ്ടായിരുന്നു, അതെന്താണ് വേഴ്സൻഡ് ആയി എന്നുള്ള ഇൻഫർമേഷൻ നമുക്ക് പ്രസൻറ്റ് ബോഡി പാരഗ്രാഫിൽ മെൻഷൻ ചെയ്യാം. ആൻഡ് ഹിസ് കണ്ടീഷൻ വാസ് ഡയഗ്നോസ്ഡ് ആസ് മെൻഷൻ. His condition was diagnosed. Therefore, he was managed with antibiotic, amoxicillin. ഈ amoxicillin antibiotics ഒക്കെ വെച്ച് നമ്മൾ പേഷ്യൻറ്റിനെ എന്ത് ചെയ്തു, മാനേജ് ചെയ്തു. So നമുക്ക് എന്ത് പറയാം, Brett was brought to the hospital by his mother with a 2-month history of nasal congestion which has worsened. അത് worsened ആയിട്ടുള്ള ഒരു 2-month history of nasal congestionുമായിട്ട് patient admitted ആയി എന്ന് പറയാം. After once the diagnosis has been confirmed, he was diagnosed with the condition and was managed with amoxicillin 50 mg per kg hourly. നമ്മൾ എന്ത് ചെയ്തു, ഈ ഒരു കണ്ടീഷൻ സ്റ്റാർട്ട് ചെയ്തു ആൻഡ് ഇറ്റ് ഹാസ് ബീൻ കണ്ടിന്യൂഡ്. അപ്പോൾ ഓൾറെഡി മാനേജ്മെൻറ്റ് എന്ത് ചെയ്യുന്നതാണ്, കണ്ടിന്യൂ ചെയ്യുന്നതാണ്. സോ വി ക്യാൻ റൈറ്റ് ഹാസ് ബീൻ മാനേജ്ഡ് വിത്ത് എന്ന് പറഞ്ഞ് നമുക്ക് സെൻറ്റൻസ് കൺസ്ട്രക്ഷൻ തുടങ്ങാവുന്നതാണ്. Okay, and in nasal and ear toiletings before feeds as required. So nasal and ear toilets were provided for the patient നമ്മൾ എന്ത് ചെയ്തു, prior to each feed, before each feed, ഓരോ ഫുഡിൻ്റെ മുന്നിലും he was provided with the nasal and ear toileting. എന്തിനു വേണ്ടിയിട്ടാണ്, for a clear congestion, ഒരു clear congestion clear ചെയ്യാനായിട്ട് വേണ്ടി he was provided nasal and ear toilets before each feed and has made good stability. good stability and അയാൾക്ക് ഉണ്ടായി എന്ന് പറയാം. ആൻഡ് നമുക്ക് പിന്നെ പറയാവുന്ന കാര്യം എന്താണ്, he has made good progress with the flu fluid or well tolerated with the flu fluid, and however his congestion restricted nasal sucking ability. Sucking ability നെ എന്ത് റെസ്ട്രിക്റ്റ് ചെയ്തിട്ടുണ്ട്, congestion restrict ചെയ്തിട്ടുണ്ട്. So here he is he is taking the fluid in a well organized manner, well tolerated ആയിട്ട്. So this is going to be a positive information, but the congestion എന്ന് പറയുന്നത് എന്താണ്, ഒരു നെഗറ്റീവ് ഇൻഫർമേഷൻ ആണ്. This is a negative information as well. So when we are combining positive, yeah, I am speaking in English, right, Ara? Is the session will available in English language? Yes, I am speaking in English mainly. More focusing on yes, Permit. I hope you'll understand. Yeah. Yes, definitely. We can both communicate in English as well as in our mother tongue. So it doesn't matter. Okay, so here the free fluid which were well tolerated, so that means that's a positive thing, but the patient is still having congestion which restricted his sucking ability. So here the positive and negative aspects of the patient has been combined here. So if you want to combine a positive and a negative element, you can use the connector however in between this. So you can use the connector however in between this. So this is how the sentence should be. He started tolerating free fluid, however his congestion restricted his sucking ability. So he started tolerating free fluid, however the congestion restricted his sucking ability. However the congestion restricted his sucking ability. സോ എന്ന് പറയുന്ന കാര്യം നമ്മൾ എന്ത് ചെയ്തു, അവിടെ മെൻഷൻ ചെയ്തു. ഓക്കെ, സോ നഴ്സിംഗ് മാനേജ്മെൻറ്റ് ആൻഡ് പ്രോഗ്രസ് എന്ന് പറയുമ്പോൾ വി ഹാവ് മാനേജ് വിത്ത് ദ മെഡിക്കേഷൻ ആൻഡ് ഹി വാസ് ഓൾസോ പ്രൊവൈഡഡ് nasal and ear toileting before each feeds, which provide him good progress, and he started tolerating free fluid, however congestion restricted his sucking ability. This is how we have to construct this particular information into sentence. And fine, that is all about the present. Now we have to mention about his social and medical history. So what we can tell him is Brett is the second child who lives with his parents and siblings in a rented 2-bedroom flat. This is what we can tell as the first point. Then his mother is worked till late night and his father works during the day. എന്നുള്ള കാര്യം നമുക്ക് എന്ത് ചെയ്യാം, മെൻഷൻ ചെയ്യാം. All right. So these are the information that we can mention as a social and medical history. And finally, we can talk about the discharge plan. So discharge plan, it is very important to mention about the patient's necessities first. So these 2 points should go first, and then we can talk about this particular thing. All right. So how it would be appreciated if you could continue the antibiotics for 40, if you could continue the antibiotics എന്നുള്ള കാര്യം നമുക്ക് മെൻഷൻ ചെയ്യാം. And it is please observe for signs of elevated temperature. Please observe for signs of elevated temperature എന്ന് നമുക്ക് എന്ത് ചെയ്യാവുന്നതാണ്, മെൻഷൻ ചെയ്യാവുന്നതാണ്. And the final thing, please support his mother to improve his parental skills. So parental skills in the കാര്യം we can mention at the third point. So this is how we have to write the discharge plan as well. So I hope you people got an idea regarding the construction of this particular letter. So I just want you people to try to write this letter all by yourself after listening to the lecture. That is one thing that I wanted to tell you. And another thing that I wanted to tell you for your information is the reader is a maternal and child health nurse. So which means that particular reader will be able to manage the child as well as the mother. Childനെയും മദറിനെയും മാനേജ് ചെയ്യാനായിട്ട് ആർക്ക് പറ്റുന്നതാണ്, റീഡറിനും പറ്റുന്നതാണ്. That is why it is mentioned to provide the support regarding the parental skills. So this information that also need to be kept in your mind while you are writing this letter. So this is going to be a very small letter where I want you people to take care of the minute aspects like different readers of like my maternal and child health nurse. So please do take care of these things and make your OET writing the best version. So that is going to be the end of our today's writing live session. So thank you so much everyone for being here with me and for listening to the lecture. So kindly follow this and try to write the letter all by yourself. Okay, so before we wind up, I just wanted to tell you all the very best to the aspirants, those who are going to have your exam on this coming Saturday. So നമ്മൾ Teachers Academy students മാത്രമല്ല, അല്ലാതെ ഈ എക്സാം ഈ ലൈവ് കാണുന്ന എല്ലാവർക്കും all the very best and do well and just ace your exam with the high scores. So thank you so much.